But that's politics, you know. You take half a loaf, you can't get the whole loaf. You take what you can get, you know. If the defensive backs are playing back, you take the 5-yard out and you complete the pass and get back in the huddle. So
spoken like an Ohioan. Congressman Boccieri, what about where do you stand?
The Browns to follow him.
if only. Congressman Boccieri, what about the public option for you? If it's not really clear, I think, to anyone in America where the White House actually stands on the public option and how married they are to that as a piece of the legislation that's sort of a deal breaker for them. I know that for some members of Congress it is a deal breaker. If it's not there, they won't vote on it, members of your party. How do you feel?
You know, I'm very curious by that position too, because this is a new concept. It's not been proposed before in our public policy debate, and it's a little bit unclear about how it will work. I mean, it's an idea, and it's something that we ought to have a debate and robust dialogue about. But I think it's unclear to suggest that this is the only thing that can help us drive down costs. And I think that we've got to focus on the energy that we can create by working together. I mean, the consensus that we need to drive this decision through the Congress is something that cannot be more underscored. I mean, there are constituents in Republican districts that are affected by this. And I had a woman show up in my office a while back, about 2 weeks ago, who was suggesting that the doctor had asked her to have an MRI. And she knew it was quite expensive, so she went to an insurance company to find out if she could afford it. Well, the insurance company said, no, you're going to do therapy first. She did the therapy, went back to her doctor, and the doctor said, you still need an MRI. And she went back to an insurance company, they said, no, you're going to do an x-ray. Now, to me, that sounds like rationing of health care. That sounds like rationing. And, you know, when we do the cost-benefit analysis, one of my guideposts for this legislation is, are we going to make certain that doctors and physicians are driving the decisions and not bureaucrats in Washington or bean counters in an insurance company? Physicians need to be empowered to do what they were trained to do. And my whole notion is that we have got to find a way that fits our uniquely American approach.
Okay. Physicians need to be in charge of decision-making. You guys probably read, or you have staffers who briefed you on an article that was in the New Yorker by Atul Gawande about fee-for-service, and the highest Medicare costs in the nation are in McAllen, Texas, where you have a lot of doctor-owned hospitals, a lot of doctors in private practice. Each practice owns their own MRI or CAT scan or whatever machine, and so they order them all the time because they know they can convince insurance companies to pay for it, and they know Medicare will pay for it. How is that good? How is that example of doctors being in charge of healthcare decisions good for America if that's an example of a place where Medicare costs have gone out of control?
Well, let me suggest our own personal experience that I've had. We have a 16-month-old at home, one of our 4 children, 4 deployments, 4, you do the math. But anyway,
congratulations, Congressman.
Our 16-month-old just had an immunization, and my wife comes running about midnight. I was answering some emails, and she said, look at this bill. It's about $360 for an immunization. And the insurance company was paying for about $30 of that. I said, well, what's our part of this? And then we read the fine print, and it said that this is all that the insurance company was going to pay. Now, that's 100% more, you know, than actual, you know, the bill. And so when I went out into our district, we were asking about why there's overcharging. You know, and the folks who are in the industry said that this is a result of the system that we have right now, where we have to overcharge so that we can get reimbursed a certain amount of money that we know that we can sustain our own operating costs. And
so they pump up costs because they know Medicare is only going to pay half of it, say, hypothetically, and a private insurer is only going to pay maybe 70% of it, so it's all just cost inflation.
Well, this terrible system that we have right now where we have to overcharge to get a small amount of payment and then, you know, have the patient fill in perhaps a percentage that is not working well. And to me, I think it should be a contractual obligation. We know how much an office visit costs. We know how something as simple as an immunization should cost, and it should be, you know, you make the treatment and then you make the payment.
Mm-hmm. And we have some reforms in here. Again, the key here is to reward doctors and pay docs for increasing the health of the patient. That's how they should be rewarded. We shouldn't have a system where they get rewarded for having more tests. And at some level, that may we need to address liability issues as well. And I think that's something that well, however you want to put it. You know, I mean, that's what we need to do is make sure our docs feel like they're not going to be, they're going to have to increase their own expenses and the expenses of the patient and the expenses of everyone else who's paying for it in order to, cover their own rear ends for those kind of situations. But also in here, and
that piece is not in, there's no liability reform.
We're actually having a discussion in our caucus this week about, what's going on with the liability issues as well. Again, this is a work in progress. There's 3 different versions in the House. The Senate's got a couple, I think at least, the Senate's got 100 different versions of health care reform. Within our bill, too, there needs to be a reform of the physician-owned hospitals as well. And we have some reforms in the bill, and I believe it's you can't own more than 2%. Not sure if you can do a lot of referrals to your own hospital, those kinds of things. So if you have that reform in there as well, a lot of what's happening in Texas could be prevented. And also, I think there was another area of the country, I can't remember, too, that was doing the same thing. You could see how it becomes a little bit of a cultural thing, in this little community, everyone says, oh, you're making a buck on this, how do I do it? Those kinds of things happen too. So we need to provide the proper oversight of the system as well, which isn't happening right now.
Can I ask you guys a process question about how many lobbyists have been knocking at your doors lately? I think people don't understand how the sausage is made in Washington and who's bending your ear. And I'd love to know, like, who's been stopping by to see you, and who's been writing who's been making campaign contributions over the last 3 months as this has really heated up.
I think Congressman Ryan and I both invited all those lobbyists to a town hall meeting, and we'll see. We
have 670,000 lobbyists apiece. I don't take insurance money. I may have taken $1,000 over the course of my entire career from insurance companies. That was a thing I really didn't want to get into for a variety of reasons. But they are obviously very, very concerned with what's going on, people who are benefiting from the current system. But I have to be honest, maybe a couple, I can't think of any off the top of my head, who've actually stopped in to really push one way against it. It's amazing. What's been amazing has really been, I try not to watch too much TV, but I do turn on and I see these town hall meetings. And you see
Not too many have looked like this one.
Yeah, no, they don't. And
yeah.
That's all right. But the vibe, the feeling, the approach that I get when I'm at the Warren Italian Heritage Festival on a Saturday night, is so much different than what I see on TV. We had a Democratic Party fundraiser last night at Mill Creek Park. There were about 200 or 300 Delphi people who have lost their health care, lost their jobs, saying we need health care. The one lady actually took a picture with my cell phone. She had a sign that said, old enough for a heart attack, not old enough for Medicare, need benefits. And those are the people that I see every single day, and it's so disconnected from what I'm watching on TV. I can't. I go on to a pretty right-wing talk radio host locally, who's like, "Don't you hear these callers?" I'm like, "This is the only place I hear this." Your 15 callers or 20 callers that get really upset and think yelling at me is somehow going to solve health care in America are the same people that get on the Vindicator.com website and post comments underneath it. The same 15 people or 20 people. I'm not saying that there aren't people opposed, but there is an anger in a very small group, and then most people I talk to have concerns, want to have a conversation, want to talk about it, but I think there's just a complete disconnect with what we see on the news and what people are feeling. I think.
What did you hear in your town hall, your telephone town hall this week?
I heard a lot of the traditional questions about, does this cover illegal immigrants? The answer is no. I heard about euthanasia, Sarah Palin's death panel, which of course is not, that's nothing but a provision where if the patient initiates a conversation with their doctor that they want to talk about hospice, they want to talk about a living will, that Medicare will reimburse the doc for that conversation.